Welcome to Atagi Plastic Surgery and welcome to Breast Augmentation 101. So I'm Tanya Atagi and I'm a plastic surgeon here in Lone Tree, Colorado, and we get lots of patients that are interested in breast augmentation. So I thought that today we could go over some of the basics of breast augmentation and perhaps answer some of the most common questions that we get from patients during our consultations. So we can start with maybe the most common and probably the most interesting or concerning question that we get from patients, and that's regarding breast size. So we use several methods to really make an effort to get patients to where they want to be. One is that we can talk about bra size, but as most women know, bra size is really not a scientific thing. So it kind of depends on what bra manufacturer that you're purchasing, the style, and all types of different things. So we get a general idea with discussing what cup size a patient may want to be, but we also use sizers here in the office, and they're not perfect, but they're usually pretty close and give patients really a pretty good idea of what they may look like in their clothes. So I have a couple of examples. One is that this is a commercially manufactured sizer, and basically you tuck it into your bra, and it's nice because you can kind of smush it around and get an idea of what your breast shape is going to be. So this is something that we use in the office, but what's really nice is that you can make one yourself at home. So in the privacy of your own home, you get the opportunity to try to play a little bit with different sizes and try sizes on with different tops, things that you might want to fill out better, things that you might not want to outgrow. And I think it's also a good idea to make sure that your size change is going to be commensurate with your activity level. So as it turns out, for example, this is 200 grams of rice. So if you've got a little kitchen scale at home, you can weigh out 200 grams of rice and then tuck it into a little knee-high nylon, and then use this as your sizer. And again, it's not perfect, but it's nice. The low-tech rice piece of it, you can mush it around and kind of give yourself more of the shape that your breast is going to take on. So this will give you an idea, and again, you can do it in the privacy of your own home. Try it with different outfits, activities, and get an idea, because this 200 grams basically translates into the equivalent of a 200 cc implant. So the implants come in sizes ranging from 100 cc's all the way up to 800 cc's. So we have a wide range. And so size is something in terms of using the sizers that can be helpful. And also, what I find to be the most helpful to me is to actually have patients bring in their wish pictures. So if you see someone in a magazine, a catalog, website that has a nice shape, size, proportion that you like, we have patients bring those pictures in, because we basically make every effort to try to get you looking as close to the pictures. And so the pictures are really my roadmap to get you to where you want to be, and I think that that really eliminates and reduces any kind of miscommunication. And sometimes patients will say, well, what size implant do I need to be a C cup? And that's going to be different for every person, because of course it depends on how much breast tissue that you start with. And sometimes patients will benefit from a different size in each side to get them more even. So even in the same patient, to get into an even C cup size or D or B, whatever it is that we're looking for, it might take two different sizes, two different profiles in the implants. So that's something, again, that we can try visually. During the operation, we use actual implant sizers, and they're just like an implant. They're the same shape, volume, and size overall, but it's something that we get to try on for you intraoperatively. So it's like trying on a pair of shoes before you buy them, and sometimes it might take different combinations of implants to get someone to where they want to be. So we use all of those different techniques to try to get patients to their goal. And that's, I think, a good segue into the whole issue of what kind of implant is going to be best for me. And there are, again, different shapes, sizes, volumes, projections. There are smooth shells, textured shells, saline filling, silicone gel filling, and so that's something that we can help determine what makes the most sense for you during your consultation. But a couple of things to kind of keep in mind. So all of the shells of the implants are made of silicone, including the saline filled. So the saline filled implants, they tend to feel a little bit more like a bag of water. I don't know if that's something that you can tell by looking at this, but it does tend to feel a little bit more like a bag of water, and we sometimes tend to have a little bit more of a problem of rippling and wrinkling that you can see or feel through the skin. But at the same time, if you have a fair amount of your own breast tissue, it may not matter whether you have a saline or gel implant. One of the advantages of a saline implant is that we do fill it in the operating room, so we can fill it to any volume that we want, whereas the silicone gel filled implants, they come pre-filled at the factory, so there's a little bit more of a limit in terms of the sizes, but they do come in 25 cc increments, so it's pretty adjustable in that way also. The gel implants, the advantage is that they tend to feel a little bit more natural, if in fact you can feel it through your breast tissue, and we tend to have fewer problems with rippling and wrinkling in these implants. So I would say, especially in Colorado, where our patients tend to be a little bit more lean, with very little subcutaneous fat, we tend to use more of the silicone gel-filled implants, but they're both options. The implants that I've shown you so far, these are smooth shells, and that also tends to decrease the risk of rippling and wrinkling, but also there are textured implants, and sometimes the textured implants can be an advantage because they can be a little bit more grippy, if you will, and so sometimes they can give a little bit more of a lift effect if we're trying to reduce some ptosis or sagging of the breast. And this implant also is a little bit different because it's a teardrop shape or anatomical implant as opposed to these, which are round. We tend to use more of the round because more of our patients tend to need a little bit more filling in the upper pole, and at the same time you can see when we hold them up, even the round tend to take on a little bit more of a teardrop shape. But there are specific applications for each one, and again, it kind of depends on which each person or each patient needs. The other thing that we can kind of see with a couple of these implants is that they come, as I mentioned, in different profiles. So this one has a smaller base diameter or footprint, but a higher projection, whereas this one has a broader base with a little bit less projection. So again, some of these differences in implants will give us different looks and can also help us to get patients a little bit more symmetric. So that's a little bit about the implants. Another question that we get commonly are, well, where will my scar be, or what type of incision do we use? So the most common incisions that we use for, in particular, the silicone gel-filled implants, because they do go in already filled, is an incision around the areola. So that's where you get that color change in the skin between the nipple and the breast. It's a great place to hide an incision, and the most common is in the natural crease underneath. And that scar, you have a natural crease there anyway, and it also hides very nicely because you have the shadow of the breast. That incision tends to be pretty small, 3.5 to 4 centimeters in length. So that's the most common. We tend to recommend the inframammary crease incision over the areolar incision, partly because studies have shown that the periareolar incision tends to have almost a 10% higher risk of encapsulation or capsular contracture, and that's basically excessive scar that can form around the implant that can make the breast a little bit more tight, firm, and round. So obviously we want to avoid that. So I tend to recommend the inframammary crease incision. There's also a belly button incision and an armpit incision. We don't tend to use those as much. The belly button incision is great if we're using a saline filled implant because it goes in flat and we fill it once the implant's in position. But we don't tend to use as many of the saline implants, so the belly button incision doesn't tend to be as popular. and the armpit incision. I mean, one thing to keep in mind about that is if we need to reposition your implant, or there's some challenges of properly positioning your implant, or if we need to go back in for a redo, say that there's a leak in an implant or something like that, then we need to use either the areolar or the inframammary crease incisions anyway. And some people don't tend to like the axillary or the armpit incision, because if you think about it, if you do get a scar that's a little bit visible, whether it's pink or thick or a little wide, that more people actually see your armpit than see your actual breast. So the 2 incisions on the breast tend to be the most popular. Let's see, another question that we get commonly is where does the implant go relative to the pec muscle? So the pectoralis major muscle attaches to the collarbone along the lower part of the rib and the breastbone, and it's a triangular muscle that attaches to your humerus or your arm bone and helps you bring that arm in. So we like to put the implant under the muscle. That's pretty standard these days, because it gives us a little bit of extra padding in the upper part of the breast. And so if you're wearing a low-cut top or a bathing suit, the last place that you want to be able to see or feel the implant is in that neckline area. So tucking under the muscle basically gives us some extra camouflage over the implant. And also it works out really nicely because if you look statistically, it tends to lower the encapsulation rate by almost 10%. So putting it under the muscle is great. There's a natural plane there, so we just slide the implant in under the muscle, and most of our patients don't know whether it's on top of or under the muscle unless we let them know where it is. So I don't know that I've really ever had a patient come in and say, you know, my muscle's weak or it works differently. Again, most of our patients don't know if it's on top of or under the muscle. Those, I would say, are the most common questions that we get during consultations. But certainly, if you're interested, we'd love to meet you and get all of your questions answered. We are offering complimentary consultations, so if you see this FaceTime live presentation, just mention it when you call in, and we'll set you up for a complimentary consultation so we can discuss you and your specifics more personally.